can you do the blood pressure, please? Yeah, that's Deborah. She's okay. Okay, she's happy now that you talked to her. You talked to her, right?
Yeah.
Hi, Brianna. Hi, Brianna. Who's talking to you? Deborah's talking to you, Brianna? Right? She likes you. She's smiling.
She likes you.
She's smiling at you.
Oh.
Brianna. Uh-oh. Uh-oh. Elevate. Elevate. How do you elevate? Are you okay? Brianna? No, she's not okay. She's crying. She's crying. You're not getting blood pressure? Pulse ox 88. Okay, that's low. We need to give her oxygen. You call the doctor? Call the doctor. We need a doctor, please. We need a doctor, please.
Don't you have an order for oxygen?
Yeah, she's on 4 liters oxygen with her.
And she's still at 88?
Yes.
Okay.
Dropped into 87 now.
Okay, so give her oxygen via the rebreather mask, which is on top of the crash cart, right here. Okay. And give it to her at 5 liters. If she doesn't come up at 5 liters, you can go all the way up to 10 if you need to. And what else was bothering you?
Her pulse.
Her pulse.
When was her last medication administered?
We can call respiratory and get her an albuterol treatment.
Yes. Can we call respiratory, please?
The doctor called and ordered Tylenol.
Doctor called it.
Suppository.
Okay. Tylenol. Suppository.
Okay. I'll wait till the seizures are over to do that. She's got seizures in March. Feel that back here. Oh, okay. What time was it?
Do you want to turn off the oxygen?
There we go.
Okay, she's back.
There we go.
She's back. She's back.
The seizure ceased.
2 seconds.
What time?
13:25.
13:25 is count. Very calendar. Okay. Okay. Alright. Giving her suppository. Let me use that up.
Use upset. Something around.
Okay, we accept the suppository and then holding it. Right?
Yeah, I'm gonna hold it right.
Wonderful. She's not crying. She's breathing.
Hey. I don't know. Sensors off. Is that what she did?
No. I'm not sure.
What is this noise calendar? Hey! Are you hungry, Brianna? Sounds like you're hungry.
She's hungry.
Okay, let me fix your formula for you.
She's up. She's hungry.
Oh yeah. She's hungry. Looks like she's hungry.
That's the end of the simulation.
Seizure baby just because of the way the baby
Well,
is
it's just,
having the
there's,
seizure.
you got to understand, it's a simulated seizure.
Yeah.
I mean, the newer baby that we're getting, actually, I mean, everything.
You know what?
moves.
It's because the mattress is too
Right.
soft, so when it like moves, it almost just
There's
looks like it's breathing
Yeah, but
heavier.
There's an air,
Yeah,
there's an air
Yeah, we're
pocket on
feeling
the
it. Then we
back
can feel it on the back.
that goes in and out. But you caught that, you caught the temperature right away, why the baby was seizing. The only thing you could have done different, and it's not a bad thing because the doctor didn't order it, is to cool the baby a little. Okay, take the clothes off, because that's what why did the baby go into seizures? High temperature. Febrile seizure. Right. Very good. And it was 103.8 actually, not 102. Right?
Yeah, it was 103.8.
It was
103.
102.8 overnight.
And then you got a return on it. It was only 3 minutes after you gave the Tylenol, so it went down a couple points. If you would have called the temperature at the end, whenever you're running into a seizure situation like that, okay, you want to get vital signs about every 5 minutes. Very resilient. They'll pop back up, but when they crash hard. Okay. So you guys did a fantastic job. Rescue 1, respond to IBM, unknown medical, male not feeling well.
First thing we do is park the vehicle at cease location, VSAP primary cruise, scene safe, and MOI, NOI. Number and location of patient is resource Navy. We'll go ahead and inform my general threat or walk up and establish contact with the patient. Fire department, how you doing today, sir? Seems to be the problem. My general impression. What seems to be the problem today?
I'm not sure. I really don't feel good.
You don't feel good? What are that you feeling? Go ahead and get some vitals for me.
I have some palpitation in my chest. I'm just not feeling well.
Okay, so his airway's open. Breathing rough rate. Go ahead and breathe with quality. Breathing roughly. Airway's patent. Circulation.
I do feel like I'm having a problem breathing.
Can you go ahead and give me a pulse ox quickly? Go ahead and put on an rebreather at 15 liters. Circulation, carotid and radial simultaneously. Feel a rapid beat. So go ahead and put him up to the monitor, please. So when did this start, sir?
Probably about 20 minutes ago.
All right, 20 minutes ago. Anything you're doing to make it better or worse?
No.
Is it steady? The pain, the palpitations that you're feeling?
Yeah, it hasn't gone away. I'm feeling really dizzy. I'm not feeling well at all.
You feel it anywhere else? Is it just staying in your chest? Is it moving anywhere else in your body?
No, it's just right in my chest. It feels like my heart's beating like my chest.
Okay, and it's been going on for how long now? We're going to go ahead and start an IV, put some pads on, and we're going to go ahead and electrically partner rate yourself. Go ahead and correct that rate. It's what needs to be done right now. Just understand you're feeling a little short of breath, having a little trouble breathing, having a little chest palpitation. So what we're going to do is go ahead and correct that for you and get you feeling better.
Okay. Oh man, I don't feel good.
Alright, let's go ahead and get that line started, guys. Got the pads on. Alright, so the line is established. I'm not really spiked this time. Alright, so we get the line established. At this point, his BP is a little too low, so we're going to go ahead and just electrocardioverse this man this time. So, sir, what we're going to do, we're going to go ahead and sync it, make sure our ROAs are on there, charge it to 100 joules. Sir, you're going to feel a little pressure in your chest, you're going to feel a little pain for a second, but hopefully we're going to correct this rate. Go ahead and, after we're done with this, so we're going to get it, we got it charged. Okay, 1 of them clear, 2 you're clear, 3, so you're going to feel it. Go ahead and hold the shock button, deliver our shock.
Oh.
Okay, so our man's going to responsive. Sir, how you doing? Okay, let's carefully get him on the floor. Go ahead, someone get C-spine just in case. Hold him. Lay him on the floor carefully. Okay, sir, you with?
Take it now. Okay. Go to gastric sounds.
Negative.
Okay, left.
Positive.
Okay, right lung.
Positive.
Very good. Can we get the NCO2, please? There we go. Set them on. Okay, get this on.
2 minutes CPR. Get that secured down. Go ahead, stop. Let's reassess to see what we have. Seems to be in V-fib still. Okay, let's switch CPR personnel. Let's go ahead and charge this monitor at 360 joules. Same time, I'm going to get a push amiodarone. 300 milligrams, 6 cc's in the port, delivered. Ready to go. All right, stop. 1, I'm clear. 2, you clear. 3. Resume CPR. Watch those paddles. Watch those paddles. Stop. They're on. Go ahead and charge this monitor. Alright, stop. 1, I'm clear. 2, you're clear. 3. 300 milligrams amiodarone on board. Deliver. Continue CPR. Switch personnel. Passive. Go ahead. Okay, stop. 1, I'm clear. 2, you clear. 3. Everyone's clear. Alright, continue CPR. Another dose of epinephrine. Items 1 milligram, 10 cc's. Don't worry about it.
Alright, just go ahead. Go ahead and code.
Rescue 42, JFK, how do you copy?
JFK, go ahead.
JFK, we're in route to your facility. Approximately 48-year-old male. Patient was found in stable VTAC upon arrival. Patient went unresponsive. He went into BFib. We worked 2 rounds of our ACLS protocol. Patient then came out into a Brady rhythm. We do have IVs established. Patient is intubated, following ACLS protocol. ETA about 5 minutes. We do have a dopamine drip hanging right now. All vitals are within normal limits. Blood pressure 109/92. Heart rate 84. We'll be at your facility about 2. Further questions or orders?
Negative, seeing about 5.
Hi, Mr. Sims. My name is Heather.
Hi, Heather. How are you?
Good. How are you?
I'm doing okay.
What brings you in to see us today?
I went out last night and I'm kind of embarrassed. I drank a little too much and chipped a tooth.
Oh, okay. Which area is it?
It's the one on top.
One of them on top? Okay. Well, I just want to go ahead and go over your medical history.
Okay.
Dr. Smith is going to see you today. He'll be in shortly, so let's just go through some questions. Have you ever had a reaction in a dental office? Any anxiety, or have you ever had a reaction
Anxiety? Yeah, I have anxiety.
Okay, you have a little anxiety, okay. Have you ever had any reaction if you've had any anesthesia in an office?
I've never been to a dentist before.
Never? Okay. How about any other past surgeries that you might have had where you've had anesthesia?
No surgery.
No surgeries.
Look
Okay.
at this body. Does it look like it needs surgery?
Well, you look great. I think you're doing great, but we're gonna, we can't just judge a book by its cover. We gotta see what's going on inside. So 18, 19, 20.
What happened, ladies?
Oh, 22, 23, 24.
What happened?
26. He went, he stopped breathing.
Okay. And the rate you're doing CPR is what?
30 compressions.
How fast?
One.
Let's go, ladies. Let's go. Let's go. Let's go. He's dead. He's dead. Let's go. Let's go.
Breathe 2 breaths. 1, 2, 3. 1, 2, 3. Okay, you can
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
11, 12, 13, 14, 15.
Somebody call 911.
18, 19,
20. Yes. 22, 23.
25, 26, 27, 28.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, and 5, and 6, and 7, and 8, and 9, 30.
Okay, perfect. We're gonna analyze.
Push, analyze. Stand clear.
It's already tiring to do this and I have to count out too.
Stand clear. Shock advised.
How are you doing? Do you want me to come back in?
Yeah, please.
Stand clear. Push to shock.
Oh, stand clear, Heather.
Hi.
Okay, mister.
What are you guys doing?
Okay, how are you feeling? Do you know what day it is? What's your name?
Mr. Sim.
Mr. Sim? Okay. The ambulance is coming. We just want you to stay still. Don't move your head. You're gonna be okay, okay? What day is it?
Monday?
Monday? Okay, good. No, actually it's Tuesday.
Okay, are we ready to do that filling? What did you do to this patient? How many times did I tell you to keep that armrest up when the patient's in the chair?
He's actually doing much better.
Doctor.
We said, yeah, he's feeling much
Yeah,
better
the ambulance is on his way. He's doing okay. He's responsive now.
Doc.
Good job.
Oh, doctor, he has a question.
Doc, do you have insurance?
Absolutely.
All right, ladies, simulation's over. Good job.
Okay. Well, yes, this was the first round, so give yourselves a hand.
When the simulator was brought over to you and you actually got to see him for the first time, was it what you expected or was it more than what you expected?
Oh, it was totally more. I had come over to your lab to look at it, and it was a great experience for me. And but when you came over with it and you set the whole thing up in a dental setting, which is in relation to the curriculum and the discipline, it just made it so much more valuable. The students don't get interactions when it comes to medical emergencies, and I think that's one of the key issues. You know, we treat patients that, you know, come in, we know their medical background, but it's not very often that they encounter this. So it's a type of situation that fit directly into our clinical situation.
So the mobility of SimMan and being able to use him in the clinical situation in your dental lab was very beneficial to your students.
Absolutely. And even though I want to go further and have them come into the clinic here, or I should say the lab here, I would always suggest that coming into the clinic and to have some type of situation, because it's their surroundings, it's within their environment.
So you'd like to take them out of their environment, or you'd like to keep them in their environment?
Both. I think that I could see it being built upon even within the curriculum, different classes from the beginning, and then in the novice or in the novice stage, and then maybe in the middle of their education, which is what happened, you know, with them the other day, and then even at the end, you know, building upon that. In the beginning, them just learning, you know, what an emergency is, what are types of emergencies, the different types of emergencies, and what the reactions would be. And then in a situation like we had the other day, when the patient's in the clinic, when they actually encounter a situation and what their reaction is going to be, because they have the foundation material. And then possibly in the next semester, where they know what different type of emergencies can happen, and picking out the different reactions to that emergency by demonstration of Mr. SimMan.
And did you feel that the initial orientation, where the instructor that came into the operator came in and he showed you what SimMan was about and showed you or reviewed some part of the BLS procedures and what you might experience in the simulation, did you feel that helped or hurt your simulation?
It definitely helped. I mean, he kind of, you know, told us about the Mr. Sim, or the simulation, but he didn't want to go too much, because it's a learning objective for us. So he gave us enough knowledge, a little bit about him, or Mr. Sim, to use him, you know, but he was like a person, pretty much. I mean, that's how we treated him. So I didn't look at him. I walked in going, okay, this should be interesting. You don't know what to expect. But when we went up there and he was yelling my name and I wasn't in the room yet, I treated him like a real patient. He's like, didn't want to wait any longer for his procedure, and it was really, really good.
So you didn't feel unprepared when you walked into the room for the simulation? You felt like you knew where the pulses, where to check, where to do it?
Yeah, absolutely. Like, he gave us the breakdown of like what he would be doing, or, you know, where you could find the pulse and things like that. But yeah, I think overall, he didn't give us a full course of CPR right before the emergency happened, which I think is a good thing, because I had to try to remember, filter my mind and say, shoot, 2 years or 1 year ago, how many breaths to how many, you know, pushes. So
So you said that at the first point when he started yelling your name, you felt that that was a good point, it was real then?
Oh yes, absolutely. Like I was shocked. I was like, whoa, he's calling my name. And he was like a real, it wasn't just like a machine. It wasn't like, hello. Like it was like a real person talking to me. And he like knew my responses and how to respond back to me. And he made a joke. And I was like, we were all shocked. So it was like definitely a real situation.
So when you put something in his mouth and you didn't tell him you were doing it, he would react to that?
Oh yeah, I don't like that, or he can even close, bite. He can do any. If I touched him the wrong way, he responded. So it was really, really great.
Do you feel like you had benefited from the simulation? Would you like to see more of it?
Absolutely. I think that for me personally, if I was a patient in the chair, I would want my fellow clinician or doctor, whoever, to really, really get this experience and do it frequently. Because without you doing it frequently, you're not gonna respond maybe appropriately to the situation. I mean, nobody's perfect. Emergency situations will occur where you don't know exactly how to respond. But this definitely gets you more to be doing it frequently, so you handle it better.
What do you feel would make the simulations better? Is there anything that they could do to make them better, to work more for you?
Just more frequency, maybe more of them, Mr. Sims. I think having more quantity will get more practice for everybody else, other students, other faculty, people who work in an office that not necessarily are clinicians or, actually front desk personnel. Other people need to know this too. So it'd be helpful for a lot of people. Everybody should really know and be able to practice on something like that, because it gives you the reality.